Good morning, participants. Good morning, all of you. Am I audible?
Yes, sir. Good morning, sir.
Good morning, very good morning.
Yes, sir. Good morning.
So we'll start today's webinar session at 11 o'clock. So first session is Total Communication Approach for Children with Autism. So this lecture will be given by Sini Regi Thomas ma'am. So we'll start at 11 o'clock. Before starting, so I have to tell you one thing that no link will be shared on WhatsApp group. So you have to be attended in, you have to follow chat box only. So all link will be shared in chat box only. Like at the end of every session, you will get post test and pre test link in chat box only. So be attentive during the session. Yeah, hello, Shivaji Desmukh. Please stop your presentation. Shivaji Deshmukh.
Hello,
Please
sir.
stop your please stop your presentation. Otherwise, we have to remove you from the meeting. Now we will start the program. Now, Sini ma'am will join within 5 minutes. Is about to join. Just wait for 5 minutes. We'll start the program. Again, for kind of your information, that all link will be shared in the chat box only. So just you have to be follow the chat box. No link will be shared in the WhatsApp group. You will get all links like pre-test and post-test link in chat box only. Good morning.
Good morning.
Good morning, Sini ma'am. How are you?
Thank you so much, Suraj. I'm good, good.
Let me turn out. Yeah. Yeah, we were waiting for you actually. Our some of participants have already joined and we are waiting few. Shall we wait for another 2 to 5 minutes?
Yeah, absolutely, absolutely. Yes.
We are following up them. So once they join, we'll start immediately.
Okay, all right, okay. Just to give me a cue so that I can start. Okay, I'll be.
Yeah, yeah, sure. Thank you. I request all the participants to turn on their video once because we need to take one screenshot to submit the report so that you know I can see only your names. Yeah, thank you. Hmm. I think my colleague would have explained you about how you're going to take the assessment as well as feedback today at the end of the session, right? If anybody have a doubt in this, just let me know. Anyways, I'll just explain you one more time. After every session, we are going to send you the link of assessment, and you will get in 5 to 10 minutes. You'll get a 5 to 10 minutes to answer their um, questions, and immediately after that, we are going to start the another session. All right. And today at 4:30, we 4:30 or 4:15. Okay, we're going to send you the a feedback form as well, the overall feedback form. And after the session, um, you need to give 1 day to send your certificates because we need to evaluate your assessments and we need to convert into the PDF so that we can send. So by next day afternoon, you will receive your certificates. Those who have scored more than 70 percentage. All right.
Hello, excuse me, sir.
Yes.
This is Mamta. Sir,
Mm-hmm.
good morning. I just wanted to know the
Morning.
attendance, the feedback will be given through WhatsApp or we have to stay in the Teams or in the
We will
Google
we
Meet.
will we will send you in the Google Meet chat box.
Okay, sir. Okay, thank you.
Yeah. Yeah, Sini ma'am, we can go ahead. Once again, welcome you, ma'am. I like to, yeah, I just want you to introduce yourself, or rather, explain, introducing me, so that we can go ahead. It's better you introduce yourself.
All right, okay. Okay, so shall we start? Then thank you so much, Suraj, for inviting me to the webinar. Um, I think many of the participants already asking, can we turn off the cameras? But I would really appreciate if you can just turn on the camera so that the it will be a very interactive session rather than like I'll be speaking to a screen. So I really appreciate, and moreover, it's an communication approach. So I'll be showing some of them. I will request you also to like imitate and just show me back. So I would really request you can just turn on the camera. All right? Okay. All right, so I'll start my presentation. Just give me a second. Am I audible? I request rest of the people can go mute yourself so that it will be audible.
Yes, ma'am. Yes, ma'am.
In between, if you have any doubts, you can just stop me, because if I am presenting, I won't be able to see the chat box. So better you can just interrupt and unmute and say. All right? Yes. Can you all see my screen?
Yes, ma'am.
Okay, all right. Myself, Sini, and at present I am pursuing my PhD in education from CMR University, where my research interest is inclusive education. So basically, I'm in the process of developing an educational app which will enhance the awareness on inclusive education, especially on general educators. So that is the process of a little bit about my research. I've completed my master's in NEPID only, and I have done 2 diplomas. In fact, one is in intellectual disability and one is in deaf blindness. So in deaf blindness, I have done various courses related to total communication approach, and where Mr. Suraj has invited me to speak about total communication approach. All right. So I feel that you will be, I think most of you all are special educators or like rehabilitation professionals. I think most of you all are special educators, isn't it? Yes?
Yes.
Yes, yeah. All right, okay. So in fact, I'm also so happy. I'm also a special educator. So let me see, I'll be talking more about the educational planning aspects, because see, we are not like a primary therapist or not like that. So we will be talking on basis of a special educator viewpoint. So as we all know that like autism spectrum disorder right now, like why we all will be saying it's a spectrum, because it's very unique. Yesterday, like Miss Aishwarya was mentioning that, like when we are like conquering a child with autism, we'll be meeting only child with an autism, because it's very, very unique. We won't be able to compare a child in spectrum with another child. So we won't be able to say, okay, one particular strategy which we are using can be the same, we can replicate into another one. It's not the case. It will be very unique, and we have to like encounter with multiple approaches and strategies to teach a child with autism especially. So as you all know, like if you have all these 3 characteristics in a child, especially in a child, we can see, probably suspect the child will be having autism. So that is one will be in difficulty in communication skills and difficulty in social skills, and the third one will be repetitive and stereotypic behavior. So I think like I won't be like not going very detailed into the autism aspects and all. I think you all will be having a basic awareness on the disability aspect. So my topic today, I'll be stick on to the total communication. Is somebody speaking? Is the speed okay? All right, okay, fine. So yeah, autism trial, it is very easy. So you have to check if you are in an inclusive school where the teacher or will be any parent will be suspecting, ma'am, like when we'll be calling a particular child, he's not seems to be responsive, and like he'll be repetitive, like some kind of behaviors are there, and there will be echolalia, like the parent absolutely they won't be using echolalia and such jargons and all, will be in a very layman term. They will be telling like, if we'll ask something, the child will be repeating the same back, and absolutely social interaction is a deficit in the social interaction area. So when as a teacher we will be going for an observation, we could see that like SCD usually like we will also do it with a ESA checklist and all, because see, it's not like we are not in an authority to diagnose anything, but we are very much into the education planning. As exactly yesterday Joshi sir was mentioning, like when we'll get the report, unless and until we do not know the checklist and all, like how will we plan an appropriate individualized education plan. So there we have to be, we sort of like knowing the awareness on various checklists also for a special educator, it is very, very important. So for a child with special need, the greatest gift is the child. We have to make them understand the basic thing, communication. So basically the child, when the child will be better in communication, the better the behavior. Because any behavior, all the meltdowns, all the tantrums which the child will be showing, it is the, what do you call it? The child is trying to communicate. So if you look into a typically developing child, the milestones related to speech and language, if you see, you could see that by 18 months itself, see, the 6 months itself, the child will be starting doing babbling, everything will be starting. And by the age of 1.5 years and all, the child will be able to, reception will be the 10 to 20 meaningful words will be very, very evident in the child. So if you say like tata, bye-bye, give me a kiss, everything, the child will be able to understand, mama, papa, everyone. So when it comes to 2 years of age, see, look at the repertoire of the speech repertoire. The vocabulary is able to understand 200 to 500 words. It's like, not only, it's like an average amount by the AAP, American Association of Pediatrics. So, and the child is able to, if there is no developmental delays, all the milestones are in the, in the normal range. It will be like, he's able to say around 50 plus words. It's all depends on the speech stimulation the child will be receiving. So when it comes to 3 years, the child will be able to use 300 plus words. See, imagine within 5 years, the child will be able to use most of the sounds effectively, where the child will be able to say the sound of everything. It will be completely developed very clearly by 5 years of a child. This is, I was talking about a child with typically developing. All right. Am I going very fast, or is the speed okay? Because I'm not getting any response, and neither all the videos are also off. Is that okay?
Yes, ma'am, it's good. Yeah, it's good. Thank you.
Thank you so much.
Yes, ma'am, it's good.
Yeah. So what is a total communication approach? Actually, total communication approach, it's not a method. It's actually the term firstly coined by the Holcomb in 1967. It's not a latest term also. And from there, like in Maryland, first of all, the communication approach were vastly implemented in children with sensory impairments, where the child will be having issues in hearing as well as with the issues in vision, like blind or low vision. So where the total communication approach was widely used. But it's an education philosophy and borrowing techniques from different variety of methods. Actually, total communication approach will be like shamelessly copying all the methods, okay, which will be useful for a child with special need. There won't be any limitation, okay. If a child with intellectual disability, we will be primarily using task analysis and the teaching strategies with the prompting, shaping. Okay, so it's like a fixed set of strategies are there. All right, in autism, like teach and DRI, DRO, it's not like that. We will be using all kind of methods, strategies, whatever useful for our child. With based on the assessment of that particular child, we will be looking at the strengths, and parallelly we will be looking at the areas to improve. And we will be using all sort of strategies. Nevertheless, it will be like a visual impairment, hearing impairment, autism, epilepsy, or cerebral palsy. All the strategies we will be borrowing, and this is called total communication approach. So the term firstly used by the Roy Holcomb in 1967. So as I explained earlier itself, like from their lot of studies, they have used not only with the children with sensory impairments, they have used it in various disabilities. At present in RPD, how many disabilities they have mentioned? Anyone? In RPD Act in 2016, how many disabilities we have mentioned in the Act?
4 disabilities. 4 disabilities.
21.
Yes, so it's 21 now, because see, we have included 21 acid attack victims also included, because see, that is a damage caused by the acid. It's a it will be a permanent one. That is also, so they are also included, and muscular dystrophy. You just go through it. Okay, that is the latest one. And we have like a PWD Act, National Trust. So these all amended very beautifully. They have written in the RPD Act 2016. Please go through it. There are 21 disabilities mentioned. All right. Yes, Ray. Very good. Very good. Yes. So the number of modes of communication, as we exactly mentioned, we'll be using speech, we'll be using lot of visual schedules, we'll be using auditory method, written form, and there is one more added attribute in total communication, that is sign language. Okay, all right. So basically the modes of communication will be sign language, finger spelling, print on palm, speech, lip reading, object of reference, tadoma, braille, moon god, gestures, symbols. I don't think so. Now I think we have completed all kind of visual, all that's it. It's kind of multi-sensory. We'll be including all sort of strategies into total communication. So because see, we won't be, if we are approaching or one particular strategy, we will be using only one strategy and we'll be very limited. Okay, and there won't be any option. But when we are using total communication approach, it will be very vast. There is no limitation. Okay, we have to go only one way. We can use absolutely complete freedom to the educator and the parents as well as the child to use in any method which will be suitable for the communication baseline assessment. All right. So what is an object of reference? All right, object of reference, any object which will be denoting a particular object towards a person or an activity or an event. We'll be using a particular object because if we're very useful, like a very simple one, we can just, for an instance, we can take, we'll be using a cup, okay, or a glass, for it will be associating to a drinking activity. We'll be using, maybe you can use a small incense sticks for a social or a greeting activity. You can use a small symbol of a shoe, symbol of a small kind of a miniature, any miniature object for a walking activity. So which will be represent a person or an activity. So when we are used to, like when we will be studying that time, like we'll be using a particular object every day, so that that particular object will be associated with Miss Sini or Mr. Suraj, like one particular object. So if I'm wearing a particular hairband in my hand, we'll be asking the child to feel, will be, because many of our children with autism also will be having very difficulty to maintain eye-to-eye contact. So we'll be asked the child to like feel, and we'll be saying that, okay, this is Sini. And make sure that you'll be using that object every day if you are representing that particular object to a person. I think object of reference is very clear with you all. The same way you can initiate communication. Thank you, Shailaja. Thank you so much. So we will be using particular, okay, because the child will be having very difficulty to anticipate. What is anticipation? Anybody has any idea? You can just unmute and speak, because I won't be able to see the chat box.
Ma'am, anticipation means expecting something, no ma'am?
Exactly. Very good. What is happening next? Because you all will be, you have a very prior anticipation. You all know that after this session, there is one more speaker. Because why did you know that? How come you all are like very much like well anticipated about this event?
Because we have it in the agenda.
Yeah, exactly. Because you got the schedule early from the organizers, isn't it? So you are aware that what exactly happening, and you know the exact link to go. And imagine a child with autism in an inclusive setup, because see, I'm working in an international school in Trivandrum, so I'll be talking about the students in an inclusive school setup, where there will be lot of activities and the child is no clue what is happening next. The kind of emotional feelings inside and the trauma and the tension which is going inside the mind, can you imagine? And right now, you know what exactly happening next, and you are relaxed. Okay, it will be finishing by 1 o'clock, and after that, it's a lunch break. The schedule, you know all the events. That's what, that is anticipation. And that is the primary basic thing for an initiating communication. So next we'll be talking about, I'll be actually cues, cues, gestures, symbols, everything I have coupled together. So cue, what is a cue? It's a prompt to encourage a particular behavior or a communication. We'll be touching a body part, okay? But make sure that you'll be consistent in using that same one. If you ask the child to get up, you can just tap a small touch on the back of the shoulder, okay? Asking the child to stand up. Understood? And if you want to stop drooling, you can just touch the child to over maybe a gentle touch on the chin. All right, and then you will be then it has to lead to an action. You'll be asking the child to take out that towel and slowly wipe out. Then the child will understand after slowly multiple times of revision. When the teacher will be asking, when the teacher will be touching over here, it means I have to take the towel and yes, I have to wipe out my saliva. Or you can. Yes,
sorry to interrupt.
No problem.
Ma'am, cue can be verbal also?
Absolutely. Verbal cue also we can give.
Okay.
I am just giving some time. Okay. Actually, see, there are a lot total communication. I won't be able to finish within this 1 hour period because Suraj has clearly explained that there should be feedback and it should be an interactive session. I want you to participate well. So there are multiple divisions, visual cues, object cues. There are a lot tactile cues. So I won't be going very detailed into each of them. We'll be giving, you can just absolutely go and I'll be giving some sites also. You can just explore. All right.
Fine, ma'am. Thank you. Thank you so much.
Okay. So it's a prompt to encourage. Okay. So it will be encouraging to a particular rewarding. It's a kind of rewarding to give a specific behavior. Exactly like a gestures. It's all like very overlapping. It's a visible body actions to communicate a particular message. So it's just as very commonly we'll be using, if I'm telling, okay, this is yes, okay, no, don't use it, or this is a universal sign, isn't it? If everybody is there, it's already using it because you do not want to unmute and speak. Everybody was most of you were doing the sign. It means it's okay, ma'am. You can just continue. So that's all gestures. Where a symbol, that's something. It's when we are using symbols, it will be a symbolic communication. Where we'll be using a pictures. That is the basic of PECS. What is PECS? Pets?
Picture exchange communication system.
Awesome, Jasira. Excellent. It's a picture exchange communication system. And we can use many visual. That is the basic of anything. Visual schedules. When you create a visual schedule to initiate communication for a child with autism, that is the basic. That is all called augmentative communication or symbolic communication, whatever method. There is no, you have to understand, when we are working in this field of special education, there is no right or wrong because everything is trial and error method. We are not working with a machine. It's not like we will be working in the system and developing a program and we can do it. It's all human being, Baba. So what we have to do it? We have to attempt this particular strategy. Might be working, might not be working. Don't be panicked. Don't be feel so desperate. Oh my God, I think my qualification is not enough. My experience is not enough. And feel so pathetic in front of some teachers will be very very low confident, low motivated in front of the parents. How will they trust us? We have to try out. Don't worry. If one particular strategy is not working, we will try another one. Understood? All right. Finger spelling. I'll be showing a few finger spelling so that I want definitely everyone, please turn on your cameras because I'll be teaching you minimum 5 to 6. It's if you are ready to learn more, I'm absolutely fine. I can teach you 26 alphabets also. So finger spelling is the process of spelling out words by using hand shapes that correspond to the letters. Imagine the child will be having complete difficulty. I'll be coming to that part, actually speech part, I'll be coming to that. The child is having difficulty. We'll be slowly initiating hand shape, which will be representing to words. All right. So if this is a bottle, okay, I can do, it's basically if I'll be asking you what is the spelling of bat, you can say B-A-T. That is also way, and you can say sometimes if you're not introduced to phonics, the children may say BAT. That is also absolutely fine. But right now the major emphasis we are giving like a phonetic system, so we can say BOTTLE like a B O T T L E. So same way I'll be saying BOTTLE. Very easy. I'll be saying A B C. Is that okay if you can just turn on the cameras at least for, I know that it's absolutely fine. You all are wherever you are sitting, it's absolutely fine. Please turn on the camera. So it's absolutely fine. A, B, C, D. All right. So the same, this is finger spelling and I am showing this is breakfast. So slowly from finger spelling, I'll be converting that spelling into a sign. Okay, specific hand shapes and body movements to express a word itself. I'm not saying that. Okay, I'm not saying this is BREAKFAST breakfast. Instead of finger spelling, I'm using breakfast. You understood the difference between sign language and finger spelling?
Yes, ma'am.
Okay. All right. So that is the difference between. So when we'll be converting into, if I'm saying, thank you so much for the session, that is thank you. This is thank you. If you like something, you can do an applause. This is clapping, applauding someone. All right. And this is thank you. And even I can do the finger spelling also. THANKYOU. That is thank you. So I hope you understood the very, very subtle nuances of finger spelling and sign language. Okay. Now we will be slowly moving to print on palm, where the method is used to where we'll be writing letters on the palm on the child. Okay, palm of the child. Make sure that you will be writing block letters. That is the capital letter. And you have to see like whether the child is knowing, because see, there will be two kind of difficulties, no? Like when the child will be having low cognition, that is called low functioning autism, and the high functioning autism. If the child doesn't know the alphabets and the letters, there is no point in using print on palm. You understood? So you have to see the cognitive development aspect of the child as well. So if the child is able to recognize the alphabets and to in that educable category, we can try on all these aspects. So that is the complete educator's jurisdiction to start from which strategy. That's what I'm just telling. You will be aware about lot of things and you have to do the baseline assessments to think about which strategy will be applicable to that particular child. And you shouldn't do like multiple strokes and all. It will be very difficult for the child. Make sure that you will be doing only one stroke at a time. All right. If you do multiple stroke, because see the child won't be listening at all. You feel, and mostly the the child with autism, they'll be good in visual perceptual skills, and the child will be able to know that much. They will be giving the attention to the details. But as if like he will be looking at somewhere, like not giving eye-to-eye contact and all. So you have to make sure that the strokes will be very carefully. You have to do not repeat multiple times. It will be confusing for the child. And Tadoma, actually, I told you earlier also, initially they were using these kind of techniques in the children with sensory impairments, where the child will be having difficulties in vision as well as hearing. So that is the reason you can see Helen Keller, she was using that technique where we will be placing our hand on the speaker's face. All right. The thumb will be facing on the speaker's hand and our fingers will be on the jaw lines like this. If suppose you are the person to receive the to read the speech, this will be the position. Sorry, yeah. Okay, and you can also then the person can be receiving the vibrations of the speech, and I should say we need like a high cognition to analyze the subtle vibrations of the speech. Understood? It's not easy for us because we will be completely 90% we'll be relying on our visual information. we are actually not at all using the tactile sense also. If we touch also, like we won't be able to see. You can do the activity when we are like in inclusive schools, we used to do like on the back we will be writing some letters and all some words, and the person has to identify what exactly we have written. And we won't be able to use, because see, our complete information relying on and visual and auditory. Okay, so this is Tadoma, and we have to see like whether the person is comfortable, because see, mostly mothers will be the person will be doing this technique, because sometimes as a speaker the person won't be able to like that the students or will be placing their hand on the mouth, and also there are a lot of difficulties. So Tadoma is a very high cognition is required in doing this technique. And as you all know, we all are like, we, by God's grace, we are able to speak. Speech is the expression of our ability. Speech is a very, very complex process where we need multiple coordination of our biological organs as well as the cognitive process and the thoughts. Everything should simultaneously work towards to develop a proper speech mechanism. You remember, for a child with a difficulty or a child with a special needs, the basic jaw should be like, if you see a child with a cerebral palsy or a sorry, a child will be having additional kind of physical impairment, it's how hard for them to produce a single sounds. The child will be having utter difficulty to utter a single sound. It will have a major time for them to utter a sound. It will take a lot of time. We should be very patient. Understood? So that is, a speech is such a complex situation, mechanism. Actually, when it comes to, there are a lot of studies, especially there are a depth of studies in India, but a lot of studies teach the child to communicate first, isn't it? Because see, the speech mechanism should develop. There is a developmental age, maybe most probably we could say that maybe 6 years, or up to, if we are stretching little more, than up to 9 years. After that, the development of speech or the child will be walking, such kind of milestones will be very difficult for a child with special need. So your parents will be like giving lot of emphasis on, ma'am, I will be coming to you only, my child should speak. That's all. That is my agenda. That is my goal. So we shouldn't, at the same time, we shouldn't discourage the parent also, because see, already they have like undergone a lot of trauma in their life, and will be, because see, if the child is not speaking, then immediately like it will be very visible in a family function. So the parent will be also will be undergoing a lot of emotional turmoil. So we shouldn't be like hurting their feelings, and slowly we have to make them understand that, ma'am or sir, we have to simultaneously try different methods also. So as and when speech record, we can slowly fade the signing. It's not only that we will be, oh my God, my child will only rely on sign, nothing, no study. That's what you can just read out. There are many research studies support the teaching sign and sign language at the same time will increase the likelihood that the child will speak. I have around 3 to 4 research studies supporting that. If you are like, because you will be stimulating the areas of brain very hardly, because see, you'll be giving the stimulation of like the body movement, the kinesthetic areas also like stimulating, and multisensory. So there is a likelihood the child will speak fast also. And because as I said earlier, unfortunately, many of the speech therapists or like teachers, we will be giving a lot of emphasis on the speech. Are Baba, when the communications, already the lot of problem behaviors will reduce. If you are worrying about the child will be showing a lot of meltdowns in the class as well as at home, that is the manifestation of the child is unable to communicate. Once the child will be able to communicate better, all these behavior will be subsiding. Okay. Anyone has any doubts so far?
Excuse me, ma'am.
Yes.
So this is Mamta here. Sorry to interrupt you again. Yeah, since you have told that the sign language will not hinder the verbal speech, right?
Yes.
So, like using the sign language, my child is never attempting to speak because work is being done non-verbally. So, is it wrong? Question?
I'll be telling you, sign language is a very structured system. If you see ASL, that is American Sign Language, or Indian Sign Language, it's a well-formed communication system or the writing system where they'll be having a lot of syntax, semantics, everything will be there. I would strongly suspicious maybe the child will be stick to the symbols. Understood. When the child will be pointing or will be, because I did not go very detailed and like I have given you a very peripheral one, but trust me, lot of sites I'll be giving you, so you can just go and because see, as a special educator, when we'll be like so confident, we have to. I'll assure you that we have to have the experience, okay? Because each child is
in front of the camera just now. Okay, my name is Dr. JVD Prasad. I'm a former physiotherapist in the Sweekaar Foundation in a PMRC. Okay, the physical medicine and rehabilitation center. Okay, so today our topic is on effectiveness of trampoline and Swiss ball activities. Effectiveness on trampoline and Swiss ball activities on the autistic kids and MR kids. Okay, so the naturally our role is really unique than others because we specially concentrate on eye-to-hand coordination and balance and body coordination and also with physical motor controls. Then physiotherapy roles is mainly on fitness and also with the brain control and also with the eye to hand coordination, especially in autistic kids. What we say like is like physical and motor skills will be low backed because of hyperactivity and aggressive weight. I mean the increased weight, appetite will be increased and they will be doing so things and they will be saying acronia and they will be starting saying over and over, they will be doing the works over and over. Okay, so these particular centers will be merged in the brains, and that's the reason the kids are behaving like that in the Asperger's syndrome. Okay, so especially what happens in the physiotherapy role, the main thing which we discuss, which we concentrate on the autistic kids is like coordination. Okay, so they don't have a good ample of eye to hand coordination and they don't have a good eye contact, and also they are not into social mingling. Okay, so if the person is not making a good eye contact and if the person is not socially mingled, then the kid
Excuse me,
may.
sir.
Yes, ma'am.
Sir, you're showing PPT?
No, ma'am. I'm just showing my face.
Okay.
Can I continue?
Okay, sir.
Yeah. Thank you. Okay, so because of low eye to eye coordination and because of low eye to hand coordination, because of aggressiveness, because of hyperactiveness, and because of low center of gravity, and because of low eye contact. Okay, so the kid may be different than a normal human being. So naturally, let's discuss what happens in the brain and what are the physiological things which happens in the brain. If we are a normal human beings, yes, we are normal human beings. What happens to take a command? If I have to take a normal pen like this, if I'm taking a pen from my pocket, if I'm opening the pen cap, then my brain is sending impulses to my hand. Sir, I am not visible, it seems. Wait a minute.
It's audible but not visible, sir.
Okay, madam. Just a minute. Yeah. No.
Yeah, it's okay.
Is it okay? Is it fine? Okay, so if I am taking a normal pen from my pocket, okay, then in this fraction of seconds, as a action of 3 seconds manner, which I did, taking a pen from my pocket, no, that has to be 6 commands from our brain. Okay, so naturally, what are the brain parts which are involved in our skull? It's a brain is made up of 3 different parts, which are cerebrum, cerebellum, medulla oblongata, and pons, which are interconnected from the spinal cord. Okay, so now in the cerebrum we have different center numbers. Okay, in the cerebrum we have different center numbers where one center is capable of doing so and so things. capable of doing so and so things. Now, in this particular brain, okay, if you want to make an eye to eye contact, then one particular number center is responsible. And if I want to talk, then one particular brain center is responsible. Literally, we have more than 80 brain centers which are responsible for our socially, personally, family, and attentional works which we are involved. Okay, so if this thing happens, so naturally in the brain we have different centers, and also which is divided into two different parts, which are upper motor neuron and lower motor neuron. So whatever the things which we do in our upper trunk, which we call as the lower two legs are called lower limb, and upper hands and trunks are called upper limb. Okay, so whatever we do with coordination, they are from upper motor neuron. Whatever we do with the physical activities, they are from lower motor neuron. Okay, now in this particular thing, these two things are bilaterally connected in our body. Then when the normal kid, if we give a order to our brains, then it happens in a fraction of seconds. That's because our brain is more than 30 supercomputers. Actions come together and we do it in a fraction of seconds. Same thing if we are doing it in a zero point 0.3 seconds. In the Asperger's syndrome, I mean the ASD kids, they can't keep those 6 commands in a 6 different things at a time, because in their brain, all these centers which I have seen, just like the talking, walking, shuffling, eye to eye contact, and socially mingling, socially smile, all these things are in different brain sectors. Now, in that ASD kid brains, what happens is like their particular windows will be shuffled out, and they are connected from one arrow to another arrow. That means if I am concentrating on one particular window, they have to concentrate on 3 particular windows, and they will mix these 3 knowledges, 3 informations, and they'll try to do 3 at a time, but they can't do that physical activity 3 at a time. So that's the reason her brain functions increases and their adrenal rush will be increased, and that's the reason the ASD kids are really hyperactive with their thoughts. Okay, so to equalize them, to control them in that particular thing, we make them to control their emotions, we make them control their coordination, we make their things to decrease the hyperactivity. We do activities called trampoline and Swiss ball activities. That's how we work with the trampoline and Swiss ball activities. Now, what happens in the Swiss ball activity? So, the trampoline is a basic elastic hybridous table where if you jump for once, it will make you to jump for twice or thrice at a time in a frequency of up and down. Okay, so in the brain, when the person is jumping up and down, not on the latest things, up and down, then brain activities will be shuffled out, and they will concentrate only on the ankle movements, on the foot. Okay, so if their ankle movements are stable, because if the ankle is not stable, then we don't have a good coordination, which we call center of gravity with the base of support. Okay, if the person is standing with the 2 legs, then the lower limbs, isn't it? The first 2 legs are lower limbs, and the upper part 2 hands are upper limbs. This particular trunk and upper limbs body should be managed with these 2 lower limbs. That means the person should stand with a good base of support, with a good eye to hand coordination, and with a good center of gravity. In these 3 things should be controlled with a parasympathetic nerve system, which is there in our spinal cord, which goes accordingly. We don't have to think about that particular thing concentratingly, but if the person is standing, they have to do unknowingly wo ho jata hai. Okay, so if the person is standing and jumping on the trampoline vigorously for 20 minutes constant, his physical ability, because if the person is doing core stability exercises like jumping, walking, kneeling, and also running, then what happens, the vigorous activities of 20 minutes can lessen the glucose levels, which also decreases the adrenal content, which means indirectly we are calming the person's brain with the physical activity. Okay, which may decreases if the person is calm, and if the physical activity may be strained up, her brain, the person's brain stereotypical behaviors may decrease instantly. That means aggressive behavior may be gone. Okay, and we teach them accordingly with a good eye-to-hand coordination tools. We also use fidget toys. We also use fidget toys. We also use sticks. We use good commands because ASD kids are very sensitive with the big sounds, isn't it? ASD kids are very sensitive with the big sounds. So what happens is like if the kid if we are very loud with the kid, then the kid may close his eyes and the vestibular activities may be going down, and the patient may go, I mean, the kid may go into depression, if not into regressions. So that is not a good thing which we have to see in the patient when we are giving treatment, if not BT, if not OT, if not on the trampoline activities. So the trampoline, when the person is jumping for 20 minutes, especially for 20 minutes, it may decrease aggressiveness, hyperactivity, stereotypical behaviors on the kid instantly, because 20 minutes of continuous activity may decrease the glucose levels and adrenaline rush in the brain, but glucose levels in the body, because the continuous activity of 20 minutes may strain up the muscles and it may give spasm effect. Okay, so the person will be tired off. And in the brain, due to low adrenaline contents, stereotypical effects, I mean the aggression behaviors may decrease. So that's the reason the continuous progress of 20 minutes may decrease the person's things, and it also gives a calming effect. But we give only 20 minutes therapy and 20 minutes trampoline effect. And after 20 minutes, again, we will go to Swiss ball activity, because a continuous activity may get bored to the ASD kids. So we use alternative techniques like trampoline jumping, trampoline walking, trampoline sitting, and bifocal NDT techniques, neurodevelopmental techniques on the Swiss ball activities and also on the trampolines. We may give some stick or a wand of which is equal to the person's height, and we hold that stick, and the baby will be holding the stick, and they will be jumping in the same series order until and unless they get tired. And it should be 20 minutes. It may be according to the repetitions, it may be according to the time, it may be according to the sessions, it may be according to the interval period which we are taking on the trampoline things, but it should be accurate of 20 minutes, because it gives because research in details, R&D shows that many articles have been proved 20 minutes of NDT techniques on the trampoline decrease the stereotypical and behavioral aspects on the ASD kids. So naturally, a trampoline is designed in a psychological way, and it gives the calming effect and also attention things which we do, and psychologically it makes persons happy. So already if the person is autistic, it's happy, then we are making him strain and we are giving him the therapy. Okay, and this is about the trampoline. And if we go according to coordination and motor skills, then we have to use which we use actually is a Swiss ball, mid-aged Swiss ball. Okay, Swiss ball is a normal yoga training ball where it is made up of a latex rubber. It's a big balloon type structure with half of the weight on it. Okay, so the ball can bounce it. If you bounce it, if you press, if you give a good pressure on the ball, it can bounce more than 8 times. It's that linguistic thing which we give. Okay, so the Swiss ball, naturally, when we treat the Swiss ball activities, we give NDT program techniques where it also increases vestibular stimulations and also eye-to-hand coordination, and which gives center of gravity and base of support. Center of gravity and base of support. So now trampoline has, it helps coordination and bilateral motor skills. Swiss ball can give Swiss ball, when you move Swiss ball on the to and fro motions and the side motions, and if the person is on the supine position and we move to and fro motions, equilibrium things, and vestibular activities and the spine stability exercises which we perform on the kid by holding in the placements. And then what happens, the kid may get instant different types of physiological effects, which means naturally we human beings, normal human beings, can have a understanding capability, and also they do. Autistic kids do, but the plan of action is different in normal human beings, in also in the autistic kids. So if the person want to work, if the person want to take, they track that a particular timetable. They go according to step by step manner. But in autistic kids, if they are planning to do, they have to do all together because they are fed up with the timetable. They're fed up with the things which they are doing, and they're fed up with the routine works. So that's the reason they are very active, and they do regular works. They repeat the things. They repeat the tappings. They have tremors, and also they have a to and fro motions, and they have a physical activity. To calm down all those things, the kid may not be sitting on the couch. If not, the kid may not lying continuously for more than 10 minutes on the bed. So what we do is like we use a Swiss ball. We make them to sleep on that thing, and we give stretching, strengthening, repeated motors, motor skills, NDT techniques at a time. At a time. So all these things are coming together only in one thing, which is Swiss ball. We can give stretching, strengthening, spine stability exercises at a time on the Swiss ball, which means in one movement which we are performing on the ball will give 4 to 5 exerciseable effects on one particular body. It gives stretching, it gives strengthening, it gives core stability, it also gives coordination exercises on spot. Okay, and to calm down the effect of the person, to calm down the effect of the kid which we are treating, the kids, the Swiss ball is the best activity, because if the person is jumping with the Swiss ball activity, he may not produce the good ample of directional views which Swiss ball make. So what we do is like we use it as the NDT technique, neurodevelopmental technique, and we give BT, behavioral therapy. We give eye to hand coordination exercises. We give differential modes on that particular thing. So what happens? There are a chances. I agree. There are a chances of getting a ankle sprains. There are a chances of getting a muscle tears. There are a chances of getting a what is a physical activity tendon. I mean the sprains and tendonal tears, which are partial, maybe severe. I agree. Those things may happen, but they won't happen when we are taking with a good precautions, and if we are doing them in a good regions. If the kid is really attached to us, if the kid is personally attached, if the kid is listening to us with a small amount of time, if the kid is liking us, then he will do according to our works. And basically my thing, what my experience is like, if we are treating ASD, it may be with the trampoline, it may be with the Swiss ball, it may be with the any other NDT techniques, any other things which we do. But the thing which we have to see mainly on autistic kid is like the kid should follow us at any cost. That means the kid should like us, the kid should be liking us, the kid should know our behavior, and the kid should be knowing it's a treatment, but it should be like a play therapy, because autistic kids are all about playing. They need enjoyment, they need a therapy, they need regression therapy, they need recreation therapy, they need play therapy, but they need treatment. So we know that they need treatment, but they are coming towards us, they are liking us because we are very jovial, we are very comfortable, we are very friendly, we are very what means playful. So that's the reason a smiling face, a hiding eyes, and also with a murmuring mesmerism hands, and sometimes through small techniques like a magic can help to get attracted to the autistic kids. And all these things may help to give a treatment, all these things may help to give a treatment to the autistic kids. Okay, so all these things what we use is like if the kid is coming towards me, if not, if the kid is coming towards the physiotherapist, what they will do, like they will play with the kid with all these things. Trampoline, it may be trampoline, it may be Swiss ball, it may be endo techniques, it may be wand, it may be stretching, it may be strengthening, it may be steps, it may be vamp, it may be with just many things. Okay, so it's like we are playing with the kids. They think like that, but we are doing our time protocol. We are stretching him, we are strengthening him, we are giving trampoline exercises which we call balance exercises, which we give Swiss ball activities which called coordination and motor skills activities. We give wand exercises, we give fidgets so that he get a good motor control and eye to hand coordination. But when the kid is coming towards us, they think it's a play therapy. And actually it should look like that, because if we are not going in his path, Actually, when we are treating ASD kids and hyperactive kids, first we need to go in his path. And after that, we have to mold him. We have to nurture him towards the therapeutical path, which should look like therapy, and also it should look like a play therapy. It should be like a playing, which it's a good thing, because I got a many good feedbacks when I was training, with the trampoline, when I was giving a chocolate. Okay, I used to train the babies, I used to train the kids, I used to give a chocolate, and I used to say, whenever you are jumping, you have to open the chocolate and you have to eat. Here, it's just example of doing that thing. Here, the kid is jumping on the trampoline, that is one work, and he's holding the chocolate, that is second work, and he's listening to me, that is he's listening to my command, that is third work, and fourth thing he's doing independently is like he's opening the chocolate and he's eating. Okay, so if the person is unable to do because of what we say hyperactiveness and different modes, okay, if we are training with the needs, if we are training with the chocolates, if we are training with the play therapy, the kid is able to doing four things at a time on our command. That is a good technique what we are doing, because eating a chocolate a day is nothing. We can go to a dentist after that, but the kid is doing different things in a different modes accordingly. If we are giving a normal kid in the assessment Asperger's syndrome, if we give a chocolate, he may not take because of a poor eye contact. If he like us, if we create a social smile in him, if we create a good response from the good rapport which we create with him, then he may listen to multiple works which we are doing on the kids. He may listen to multiple works which we are doing on the kids. So if I am giving a chocolate, I am saying him to jump for 50 times, and I am counting the 50 times, and he's jumping on a periodical things. He is looking at me, he is making a good eye contact, I am smiling and he's smiling. And when I surprisingly remove the chocolate and I give him, and he is taking with excitement, he's opening it and he's eating it, and again I'm counting the jumping methods, then that means he is mingled with my therapy. He's thinking that I'm offering a chocolate because he's jumping in a play therapy. Okay, that gives a good feedback, because up and down things which may increase the all directional brain activities. Okay, normal person, if he jumps for a 30 times, okay, his thinking ability increases 37% instantly. That means if we are in a tension, if we are unable to choose what we are doing, then we have to jump for 30 times. Psychological things says, physiological fitness says that, like, okay, if you jump for 30 times, your instantness, your decision making things, your intellectual capabilities may increase 37% instantly. So that means if the kid is doing those activities, okay, we may not be a physiotherapist, we may not be a normal human being like a on a trampoline and a Swiss ball activities, which may increase coordination in an ample of period, which is 45 days of sessions. Okay, so these are the topics which I had today. Any doubts? Hello? Hello? Am I audible? Hello, everyone.
Yes, sir.
Any doubts? Should I continue? It's just the last conclusional things which I want to add. It's like not only trampoline and Swiss ball, a good musical instruments may also increase the person's sensual aspects, and also a person's sensual aspects, and also good eye to hand coordination, and it also increases the person coordination and concentration. Just I'll take a small example which happened in my real life. It's like I had a patient called Akash, okay, and he was ASD kid, and I used to treat him with the trampoline, Swiss ball, and also many other activities. But I had a habit of playing a flute. So accidentally, when he saw me playing a flute, he got an interest to play a flute. So I didn't know that, and I placed a flute on the table. I went off, and he periodically took that flute and did experimental things. Did experimental things for more than half an hour, and he did a trial and error methods, and he succeeded after half an hour how to blow a flute. So that means if we create interest in the ASD kids, if we create an interest in the ASD kids in a different aspects, I mean in a different physical modes, it may give a good impact on his brain, on his physical activities, on his motor functions, and especially on his hyperactiveness. I am not saying it's like complete physiotherapy can decrease his hyperactiveness and also what we call a bilateral motor functions, and it also increases his coordination. But there are a may chances with a good sensory integration therapy, with a good motor skill training, with a good NTT techniques, I mean neurodevelopmental techniques, with a good stretching and strengthening program, the person may get 50% capability of a normal life, which we call a society life. Actually, the person has a personal life, society life, family life, and so on and so. But in that ASD kids, what I actually seen is like their complete life is only single life, which is the human life. That's it. It's a complete life. They think, they behave, they do all these things without a mirror shade. It's like we make mass in a family, in a profession, in a society things. But these particular kids have only one face, so that they are somewhat different in the society. So, my dear things, my dear friends, I say the trampoline and Swiss ball activities, NDT and sensory integration things may decrease his hyperactiveness and also stereotypical behavior and aggression things. They may decrease these things, but these particular things like OT, BT, sensory integration may decrease these activities regularly. Okay. So I have passed on the 5 questions depending on this things. So thank you so much for my things. I thank Suraj sir and every person for this seminar. And any doubts?
Sir, actually, excuse me.
Yeah, ma'am. Yes, sir. Please.
Sir, is this any diet reduce hyperactivity?
Diet.
Yeah.
Actually, the diet, yeah, even the diet may increase decreases the hyperactivity, but only for 8% chances, because naturally the pink salt decreases the blood pressure. Normal salt, it increases the blood pressure. If the blood pressure is increased, our brain activity, adrenaline content, adrenaline rush will be increased. So if the adrenaline rush is increased, the blood pressure increases, then the person will become aggressive and he may get aggressions. So if the person is eating masala food, if the person is eating more salty food, if the person is eating a more tastier food of the papillary things on the tongue, then he may get a more aggressions and angriness, and people may become stubborn because of the diet. But I say that a normal food diet which we take is good enough. And especially if the person is on, especially in Asperger's syndrome, they are low to take a salt, they are low to take a sweet, they are low to take a habitat foods like a fatty things. Okay, they are more into the fibrous foods. I think they are I think it may affect, but it only low level of affecting the diet depending on aggressions.
Okay.
Okay.
Thank you, sir. Thank you,
Yeah.
sir.
Yeah. Any other
Actually,
questions, please?
one more question is there.
Yes, sir.
Actually, you said that trampling is a little bit calm down, right? When one
Yeah.
of my kid is there,
Yeah.
but whenever he is going on the trampling,
Okay.
right, he is getting very aggressive, means little bit
Okay.
hyper, right? He will continuously jumping on 1 hour.
Yeah.
That it will be no use for him. Any
Yeah. Let me explain this thing. Okay. A vigorous activity on a trampoline, it may be jumping, it may be kneel jumping, it may be sitting, it may be bouncing. Okay, so we have to do it for 20 minutes and we have to give a rest of 5 minutes. Okay, so if the
okay,
person is jumping continuously for 1 hour, I think it won't possible, because he will take a periodical rest. It will take a periodical rest. I
okay,
mean, if the person is not taking a rest, he can continue only for 20 minutes.
okay,
If the person is taking a periodical rest, then he can continue for more than 2 hours.
Oh,
So it's just like jogging. It's just like jogging. If the kid is taking a trampoline, it may be basic trampoline, maybe hyper trampoline. I am saying about hyper trampoline. That means if we are jumping for one time, the trampoline should make the kid to jump for 3 times. It should bounce him. Okay, so naturally normal trampolines which we see is like if you are jumping, it's just like a normal base. It's like a normal cloth, isn't it? But the actual trampoline which we are speaking about is like if you are jumping for once, it will jump you for 6 times. That means
okay.
if the person is jumping 120 times in an hour, 120 times in an hour, it may be 120 times in a 20 times in a 20 minutes. That means in one time, if the person is bouncing, he will bounce 10 times involuntarily. That will decrease his muscle activity, and his brain and his spine will be strained off for sure,
Okay.
because he's doing only for one time and he's bouncing for 10 times. Okay, so indirectly or directly, his parasympathetic system and sympathetic system will affect on spine, which will decrease the muscle strain, and uska muscle spasm or strain ho jata hai, and the person will become weak physically. If the person is weak physically, his breathing increases, and slowly to calm down that breathing, slowly to calm down the breathing, कभी कभी वैसा breathing कम हो जाता है, simultaneously the kid will be calming down. And when he's calming down for 10 minutes, then on that 10 minutes we send the kid to OT therapy and also BT therapy, means psychological sessions, special education, and after that OT therapy, and after that things. And again, if the kid is hyperactive, again we will go to the next session called Swiss ball activity, and again 20 minutes we will do like that, and we will get a 20 minutes of time of session where he will be getting calmed down, and again we will send him to the recreation therapy, and after that last session will be play therapy, if not dance therapy. We give weight cuffs, we give 1 kg weight cuffs to one hand and also 2 limbs, and we say the kid to perform the same activities. If the person has a weight on his limbs, he may not produce the vigorous actions with his limbs.
Yes, right. Yeah, right.
Yeah, so which may decrease this calming effect. And if we do it regularly, if the kid is liking us, first thing the kid have to like us. And if the kid is into us, if the kid is psychologically and he's personally attached to us, then the kid may listen to our commands. He may not be listening at once. He may be listening at twice or thrice. 10 बार बोले तो एक बार तो भी सुनता. If you are 10 times in the 10 commands, he may listen to one, isn't it? So in that commands, he may listen once, but to listen that particular one command, he should make a eye contact, he should be listening, he should be sending brain impulses to the hand, and he will do that command which we are saying. That means in one session, if we are using trampoline, if we are using weight cuffs, if we are using Swiss balls, we are making him to listen to our commands. That means directly or indirectly, we are giving a good support, we are giving a good motor control, and we are succeeded for one that particular day, isn't it?
Yeah, thank you. Okay.
Okay, yeah, next question please.
Sir, actually, what is neurodevelopmental technique? What does the therapist do in this technique?
Okay, much more.
Yeah.
Yeah, so naturally the boo bath. Yeah, I think someone on my microphone, I am able to hear my own voice, which is really ugly. Okay. The Boo Bath, the Caroline Boo Bath, he's a psychiatrist and also a physical therapist from a different streets and abroad. He invented this NDT techniques, which is called neurodevelopment treatment, if not neurodevelopment techniques. Okay, where the person will be having a good anatomical orders, means by skin, by bones, by muscles, and by through nerves, the persons are very physically they are fit, but psychologically to the physical mode they are unfit, I mean they are not coordinated. So what we do is like we are not teaching them, we use sensory integration therapies, and we use some kind of techniques called balanced techniques. I mean we use Swiss balls, we use weight curves, we use different things where everybody has a bisymmetrical things, means we have 2 legs right and left, we have 2 hands right and left, we have 2 lungs right and left, we have 2 eyes right and left, which are coordinated. The NDT techniques are used when the person is not coordinated with 2 limbs or 2 legs. Okay, if the person is not coordinated with the limbs, if the person is not coordinated with the legs, we use entity techniques where we confuse them, we confuse with the techniques, we confuse with the things which he has control. If the person has a control of holding a paper, we say him to hold it with two hands, and after that with one hand, and after that with a weighted hand, after that with the fingers, after that with the knuckles, after that with the lips. We confuse them, and we do these things. And this is a neuro-approachal reciprocal technique in NDT. But we have different techniques like weight bearing activities, jumping activities, one leg jumping, and two legs jumpings, and a ball activities, weight cuff activities, and a strengthening program of one leg activity when the person has to stand only on one leg without taking any support. Okay, and the person has to walk, he have to stand, he has to jump. We confuse his mind with his physical activity so that he should be coordinated and he should be mastered in the motor skills. That's what a neurodevelopmental technique is. I just gave a definition technique. I can't say. I can't explain the NDT techniques indeed because it's very hard because every different approaches are included in it. It means neurodevelopmental technique is included with the sensory integration, with the vestibular integrations, with the muscle mass, strength, and spasticity. So it may differ accordingly. It may differ to the. It may varies from patient to patient.
Okay, sir. Thank you.
Okay. So next question, please.
Sir, now in inclusion when we are working,
Okay.
it is morning they attend the class, and then
Okay.
after 2 o'clock usually we have the light period. So that time they go for the, because we don't have therapies in school.
Okay.
So they go for the other centers. So it is in
Hmm.
the evening after the school. So is that
Okay.
okay, or there has to be some time, like ideal timings or something like that?
No, ma'am. Naturally, no, what I think is like we are not supposed to send, we are not supposed to set a particular ideal time to these kids because if they are habituated to timetable, they'll get bored. And if the autistic kids are bored, they won't listen to anyone. Their stubbornness will be increased. So it's okay to do to and fro things, but they have to do it. Must and should they have to do the physical activity per once on our timetable basis, which we call as a exercise protocol. It may be to and fro, especially when the kid comes to me. I may not go to the particular point. First trampoline, uske baad BT, uske baad Swiss ball, uske baad recreation therapy, uske baad special education. I won't go like that. I may change the techniques to and fro. First, I will say him to take a special education, and after that, I will make go to the trampoline. And indirectly, day by day, the kid usually confused, but the activity should be same. So that's the reason the ideal timetable may, especially in the exercises, may increase the stubbornness. What I think is like.
Thank you, sir.
Thank you, madam. Next question, please. Any other?
Hello, sir.
Hello.
Hello, sir. This is Chandu, sir.
Yeah.
Can you tell me any toe walking activities for a child?
Toe?
Toe walking activities.
Toe walking activities. So you want to perform a toe walking. If not, you want to make a
Yeah.
person to place his complete ankle on the ground.
Okay.
Yeah, let me clarify. You want to kid to walk on toe walking. If not, you want to
Toe walk.
make him to, if you want to make him into complete, make a complete ankle on the ground.
Complete handy on the ground.
Okay, so if the person is making a toe walking, okay, so three things we need. First thing is weight cuff. If the person weight is ideal, the 10% of the weight, that means I usually use 1 kg to 1.5 kg weight cuffs on his particular ankle. When the weight is on the ankle, obviously it goes to the ground.
Okay.
Even though if the person is making toe walking, okay, that means he may have Achilles tendon tightness. That means the ankle is connected to the lower limb with Achilles tendon, which is a muscle, and basically it's a thread like structure which is very tightened ligament. It becomes very tight when the person Achilles tendon is shrinked off, which is very tight. Then the person may perform toe walking. Better you take assessment on the Achilles tendon and then you carry forward. If the person is not having any kind of tightness on the ankle, then if you place a weight cuff on the ankle and if you make him to walk on wedges, ramp and steps, the person may keep complete flat foot on the ground.
Okay.
Okay,
Sir, thank you.
thank you.
Okay, sir,
The
thank
next
you.
question, please. Next question, please. Anyone? So I have a couple of minutes. Hello? Hello?
Sir, till what age we can give OT and physiotherapy, or any limit
Uh,
like that is there or not there?
it's not like that, ma'am. Physiotherapy, especially in autistic kids, it's like to lose the weight and to get a good coordination. Naturally, we do have a things called geriatric rehabilitation, where the more than 60 years people also do the physiotherapy because they lose center of gravity and coordination in their body. So it is not like we have a age limit to 70 or so and so things. We can do physiotherapy if we have a lesions in our body.
Thanks, sir.
We don't have a age limit. It's like if you have a lesion, if you have a pain, if you have a strain, if you have a sprain, then we can go to the physiotherapy. It's a good option actually to take a corticosteroids and for a 1 month and to take a liver basis and a liver hepatitis and to drain off all kidneys. It's better to take a normal exercises and stretching and hot room water things in a physiotherapy. So especially in autistic kids, we don't have like so and so things. It's about the signs and symptoms which the kids showing us. So we don't have a age factor to take a physiotherapy.
Sir,
Madam,
like it was about hyperactivity, no?
that's
If it
true.
is,
That's
yeah, teenage, and what can we do at home, like with available
things.
resources? Yeah.
Yeah, it's a great question, ma'am. I don't recommend you to take a good equipment if not a good things. But I say you to take only one towel.
Okay.
Tie some rice beans if not 1 kg weight things, and it should be look like a weight curve on the legs.
Okay.
If it
Okay.
depending upon the hyperactivity, whatever the activity he is making, on
Hmm.
ideally according to your time management, try to tie a weights on his hands, on his legs. I mean, in the ankle, whatever the act
Okay.
may be, he may be doing. If the person is having a weight on his both limbs, 4 limbs, then his calming effect may decreases. And in the home, if the person usually in the home, what are things which we get is like if the kid is throwing a glasses,
Hmm.
if the kid is throwing a utensils in the ground, better you
Hmm.
not to concentrate on him and in his activity. On first day he will do, on the second day he will do, on the third day he will think that other persons are not attending me when I'm doing this. So he's attention deficit person. So to get a
Hmm.
attention grab, he all these things. On the first day we have to bed, on the second day we have to bed, on the third day we have to do our routine work.
Okay.
But sometimes these physical activities may give a more irritation to your parents. I agree, but some kind of techniques in the food, some kind of techniques in the physical activity may demand down. Try to avoid jumping on the what we say bed.
Hmm.
Try to avoid jumping on the bread, and try to give him a what we say sneak and lateral things which may call a plumber's things. I mean the step by
Okay.
step matter. So carpet, we do have a carpets right now. On the carpets, if the person is walking with a complete flat arch, it's a great stretch and it's a great coordination exercises which we can
Okay.
perform in the home.
Okay.
And also the sofa, if the person is getting a low upper back pain, if the person is not having a spine stability on the upper back, on the sofa we may perform a push-ups which may also increase the activity of the person. If the person is having a happiness in jumping, he also have a happiness in giving a push-ups on the sofa.
Hmm.
And playing with the magnets which won't create a sound.
Okay.
Okay, we are not locking him to in the four walls, but we have to make him to create a good environment where he should think he is independent only in these four walls. That's
Okay.
what we can do. That's what we can do in our homes actually.
Okay. Thank you, sir.
Thank you, ma'am. Thank you. Next question, please. I think uh, we are done well, and I can't explain the complete thing because it's Asperger's syndrome is a happens with unknown signs and symptoms with originates, and I think I did my thing very well, and we are more into the introductions than into the treatment. I think you people liked my session. If it have had been more than 1 hour, then we would have discussed with the practical sessions with the good thing patients. I think I have given 5 patients in the series of things which we discussed about. Okay, so which is shared in the program. Try to give a theoretical answers which you people have discussed, and we will be sending a new material to the Suraj sir, which will be sent to. And I think that you people liked my session. Thank you from Dr. JVD Prasad.
Sir,
Thank
very
you, sir.
nice session. Thank you,
Thank
sir.
you. Thank you. Thank you so
Thank
much.
you, sir. I have
Thank you,
shared
sir.
that link. I have shared that link in your chat box. Please you just check that link and you just fill that test.
Okay, sir. Thank you. Thank you so much.
Thank you, sir.
Bye.
Thank you. Okay, we are just going to discontinue now. So we'll start the
Yes.
next session at 2 o'clock.